Well, it's still morning time, as my son would say back in London, way back when he was a little child. I worked for CTV in those days as a foreign correspondent, and he was born in London, and he would say, in an English accent, he would say, "Daddy, it's morning time." And so it's still morning time. I'll introduce the panel, but we've been having all of these discussions here in this format, but I think some of the most important discussions that we've been having is with each other. Just moments ago, you're meeting new people, you're hearing new ideas, and you're discovering what this country is all about and what the world is all about. And the reason why I say that, I just met a woman from Shawinigan named Indira Moody. And we never met, but we talked about a bunch of things. And she said Shawinigan. And I said, well, I worked for Prime Minister Jean Chrétien for 2 years. And as Mr. Chrétien would say to me, he would say, "Jimmy, you've been around since a long time." And so being around since a long time, we talked about her company and about protein and animal protein and what she's doing there, and her journey from different parts of the world to be in Shawinigan. So I just find that the conversations that take place with each other are equally as important as what we hear today. With that, though, I would like to introduce Peter Singer, and Peter was the former executive director of the Canadian Association of Physicians for the Environment, and this plenary will deal with climate and health and Canada's role. Peter.
Well, thanks very much. How's everyone doing? Good. So we're going to spend about an hour together talking about climate and health. My name's Peter Singer. I'm not the former executive director of the Canadian Association for Physicians and Environment, but Courtney had so many titles that some of them spilled over onto my thing. In fact, I rented out the space below my name to Courtney for her excess titles because she had so many of them. I'll introduce this great panel as we get into them with conversation, but just a couple of quick framing remarks. I'm a professor emeritus at University of Toronto. I was Dr. Tedros' special advisor at WHO and did a few other things, and it's really great to be here. Mostly I'm Stephen Huttert's mentee, which is the key issue here. But when we think about the continuity between what we just heard, the overarching theme, and what we're about to talk about, I'd like to pick up on a couple of threads, pull on a couple of threads just by way of framing. Our topic today is climate and health. More than anything, we want to focus on specific solutions. So the through line of this is going to be some comments, some asks from the panel to you, hopefully some offers or commitments from you related to those asks, and then some acceptance to try and make this a platform for action. It also resonates with one of those lessons from that Auditor General report on integrated SDG solutions, climate and health together. We're going to explore the intersection. And finally, where we can, we'll get into the CanCon and any special role for Canada and comparative advantage. Any questions before we start? Does that sound okay? All right. So let me just start by saying that what we probably want to do is pin down a little bit first what we mean by climate and health, because when you say things like that, people's eyes glaze over. So what does that really mean? Well, thankfully, actually, just a little digression. Anyone see Annie Hall? You know that part where Woody Allen pulls Marshall McLuhan out from behind the billboard and said, well, actually, you know, I have Mr. McLuhan here and he can talk about his own theory. Well, Kevin Linn just finished a PhD, or a DRPH, Doctor of Public Health, at the Harvard School of Public Health on what is climate and health. And so what a great place to start with that. So Kevin, and I'll introduce the other folks as we go. So Kevin, what is climate and health?
Yeah, thank you, Peter. I'll give it a try. But so in 2023, climate change and health was rising as a prominent global health priority while I was completing a research fellowship for my dissertation at Gates Ventures. It was during this time that COP28 was occurring and health was being featured prominently, as well as the WHO was including climate change as a key priority within its general program of work. However, despite this emerging priority, there was really confusion amongst organizations on how to respond. So for example, when just asked, how does climate change impact health? It often resulted in these long-winded answers really that reflected the complexity of the challenge, but didn't provide any conceptual clarity, especially for decision makers looking to support with strategic investments. So one of the questions we embarked on to answer was, what are the most prominent pathways in which climate change impacts health from an organizational management perspective? And what's the burden of disease associated with these pathways? And we ultimately came up with 7 pathways based on the literature. And I won't go into describing all of them because we will talk about them at some point on this panel, but I'll just list them here. The first one is pathogens and vectors, and just the role of climate change altering the behavior, physiology, and life course of vectors and pathogens across the world. The second is extreme heat. It can lead to increased morbidity and mortality from an array of chronic diseases, including mental health and adverse pregnancy outcomes. And I mentioned this when I describe it because this is a pathway that we have felt here, and I think of 4 years ago during the heat dome, which resulted in 619 deaths. Others include water insecurity and food insecurity, pathways particularly relevant for low and middle income countries. Air pollution, another pathway that is very much experienced by Canadians, it seems like, every summer now. Particulate matter from the burning of fossil fuels and forest fires enter the body and cause damage, increasing morbidity and mortality, especially cardiovascular and respiratory disease. The fifth, or another one, is mental health, separate from heat, extreme heat, but specifically from forest displacement. Another pathway we seem to be experiencing here as people flee from wildfires, people losing their connections to social supports, resulting in anxiety, depression, and PTSD. That's well reflected in the literature. And then the last one that we described was health systems that we'll also talk about up here. But really, out of those 7 pathways, there's only one where there is a quantified global estimate of disease burden that has been modeled, and that's for air pollution. And so, how it asks that question, how do we prioritize investments of scarce health and development dollars when we don't know the number of people dying or the people being impacted at a global scale? And so we must do something, though. And as I mentioned, we are feeling these pathways now. We're feeling them here locally in Canada, but we're also feeling them globally. And so what we did is we took these pathways and we combined them with solutions and metrics based on SDGs to develop a framework to support organizations and governments who are taking up the challenge of climate change and health.
That's terrific, Kevin. Thank you. So that takes us down one level of granularity. There's kind of 6 pathways, 6 for instances, and then we want to move more towards very concrete solutions. And Karlee Silva, you're the CEO of Grand Challenges Canada. Grand Challenges Canada is probably one of Canada's largest and most successful impact investment funds that nobody's ever heard of. Raise your hands if you've heard of it. Okay, well, actually, you have heard of it. That's great. I'm kind of biased. I love the thing. But Karlee, you have been supporting solutions, funding solutions in climate and health, and now you're about to launch a grand challenge in climate and health, or a climate and health challenge. And so this is very exciting. This is like a premiere. This is the pre-launch, the Canadian pre-launch of the Climate and Health Challenge. So tell us about that, and if you want, tell us a little bit about Grand Challenges Canada.
Yeah, thanks, Peter. And for when people go Google, the punchline is that we can all thank Peter for starting Grand Challenges Canada. But it's been my privilege to work there. We're essentially a mission-oriented innovation platform, and we focus on grand challenges. It's in the name. What's a grand challenge? That's a critical barrier for us to health and social equity, that if you can target it with innovation, and overcome that you're actually going to further advance what the world looks like. Make tomorrow a better day than today. And don't we all want to do that? Interestingly, in these times, I've been reflecting a lot as fellow Canadians. We're bombarded by this moment that we're in a crisis, it's looming, there's things happening. The last time I think we really had those messages globally was in 2008 in the financial crisis, and that's exactly when Grand Challenges Canada was launched. And so kind of out of a crisis and very fit for emerging times is our platform. And when we launch Grand Challenges, we really look to increase the awareness of a certain issue, a certain critical barrier, and try to attract solvers to that idea. Who has brilliant ideas that maybe didn't see themselves in that yet? And to once we fund them, we help manage the risk that helps to make innovation a really tough sell for some institutions, some people. Many, I think, will probably hear a lot today about how Canada can be a bit risk averse in its investment approach. So think of it as a de-risking platform so that by the time a solution comes out the other side of our support, funding, and technical support, that they are something that even a lower risk investor might be interested in. And we do this all to have sustainable impact. Our current goal is to reach 750 million people globally with life-saving and life-improving innovation by 2035. And as Kevin started illuminating here, climate and health is one of the big challenges at the moment. So we'd be remiss to not do some work focusing in on it. But also, as he said, it's a big area. And so before we have all the granular data that we think we might need in order to really prioritize all of these, what we thought and what we often do when we define grand challenges is to dive into listening locally. Listen to what people are actually feeling is a reality. Many communities know exactly how climate change is impacting them. We have done the largest global survey of frontline health workers in the world, over 6,400 respondents in 107 countries. And they were able to tell us very specifically what they feel climate change does to their communities, but also how it shows up in the health system. And interestingly, we've seen that these impacts, and they map very beautifully onto Kevin's framework, they're regionally specific, as you might imagine. We see some things focus much more on pathogens and vector-borne diseases and that changing of migration in some parts of the world, and other parts of the world are much more focused on the effects on chronic and non-communicable diseases. And so those results are coming out. That was one thing I was not allowed to share because it's under a publication ban. But stay tuned, it'll be coming out in Lancet Global Health later this year so that you can see where globally frontline healthcare workers are prioritizing the need for action. We've also done one call for proposals. We got, in a very short period of time, 800 applications from 80 different countries. We've funded a number of those, about $6 million to date, and just gives us a taste of who's out there, what's being pursued. So things like using solar power to harvest mayflies for food year-round in Burkina Faso, introducing portable ultrasound to detect dengue early as it spreads to remote areas of Peru, or an app that supports mental health needs of communities in coastal Bangladesh who are vulnerable to funding or to flooding. So these survey results and the results from many different points of input, expert panels, communities, et cetera, are shaping a new climate and health innovation program. The thematic areas we're seeing is about 5 out of the 7 kind of key ones that Kevin has put forward. We're going to see infectious diseases, climate resilient food systems, and chronic diseases all featuring in what we're most interested in out of this grand challenge. And we're going to launch early in 2026 with about $50 million, but we're looking for $150 million over the 5 years. That's our ambition. We think that's a way to get this whole innovation ecosystem going. And we're looking for people who are interested in that, but also for people in this room really interested in those who have solutions and are interested in exploring those further and scaling them, and stay tuned for that.
Great, thank you, Karlee. So let's give it up for Karlee and Kevin, just to keep some momentum going here. All right, so now Martin is going to take us down even further. So this is funding solutions. Martin's going to take us down even further into one example of a large-scale solution in the vectors category that he's been working on. And Martin, you're the CEO of Malaria No More. You're also doing something called Billion Scale. And you're interested in scale. You've got a very specific thing to talk about on dengue fever and Wolbachia, and you'll say more about that. And there's two angles to what Martin's about to say. One is it's a really exciting, specific example with very high impact. Secondly, the financial model and the capital stack behind the example is very useful and applicable to other applications. And I know here a lot of folks are focused on impact investing, capital stack, et cetera. Martin's actually assembling a capital stack of different types of finance behind this specific example. So Martin, do you want to just talk a little bit about the example, but also about the financing behind it?
Happy to. Thanks, Peter. Thanks for organizing this panel. Thanks to the organizers of the Victoria Forum. I'm not a Canadian, as you can tell from my accent. I am a Cascadian. I grew up in the shadow of Mount Rainier in Washington State, so took the Clipper up yesterday. So great to be here. I'm also grateful, Peter, for you sitting me and Karlee together. Karlee's an investor in our Transform Health Fund, so it's nice to be on the love seat with you, Karlee. So, you know, as Kevin talked about the pathways, I think it's worth anchoring in a moment that I think was a watershed moment in climate and health, and that was the flooding in Pakistan 3 years ago this summer. So people saw it in news reports. It was apocalyptic. It was a moment where 30% of the country's landmass was underwater. 33 million people were impacted or displaced by that flooding. And while most of the news reports focused on kind of the kinetic event of the flooding, the public health emergency was actually equally or even more disastrous that unfolded in the weeks afterward. So 2, 3, 4, 6 weeks after, we saw a 5-fold increase in malaria cases in Pakistan, a 10-fold increase in dengue cases. We saw 99,000 cases of cholera in one day in one district, cholera being a waterborne disease associated with flooding. And so it was really the moment that the world woke up to climate as a health threat, I think. You know, as that example illustrates, a warming world is a playground for mosquito-borne disease, for mosquitoes and the diseases they carry, like malaria, dengue, chikungunya has been in the news recently, yellow fever, Zika, et cetera. And, you know, broadly, there are 3 reasons for that. One, you have flooding events that disrupt health services and cause these endemic diseases to explode. I met with the Minister of Health of Pakistan recently. They're still struggling 3 years later to get back to their kind of baseline levels on malaria and dengue because of the flooding and what it did to hospitals and the health system. The second way that it impacts mosquito-borne disease is it extends the rainy season. It used to be that there was a monsoon season and an off season for mosquito-borne disease. Now they're pretty much year-round in a lot of places. And then lastly, the mosquitoes are going on vacation. They're expanding to new latitudes and new altitudes, bringing these diseases to otherwise naive populations. And so the numbers are mind-boggling. You know, dengue, the WHO estimates there are about 400 million cases per year. That's grown 10-fold in just the last 7 years. The Lancet says that we could see an additional 4 billion people at risk of mosquito-borne disease by 2070, given the trajectory that we're on. So we're seeing massive, the scope of this challenge is really growing. As Peter knows, I never want to talk about scope without hope. And the good news is there's real hope here as well. We're in what I think will be a golden era of innovations like the ones Karlee mentioned that can help us address the worsening problem of mosquito-borne disease. So we're seeing sometimes AI-driven early warning and response systems. We're seeing new therapies and vaccines. But one category of solution that I'm especially excited about is mosquito solutions. I've worked on malaria for 20 years. Mosquitoes are always the bad guys. They're always the villains of the story. And I think we may be at a tipping point where they actually become the solution to how we solve these problems. And so the example I want to give is around dengue, and it's a naturally occurring bacteria called Wolbachia. It's a mouthful. Happy to spell it out if it's useful, so you can do more research. When I was telling Courtney backstage about this, she said, oh, so it's kind of a planetary health solution. And I hadn't really thought about it in those terms, but I think it really is. So this is a naturally occurring bacteria that affects about 50% of insects anyway. But when it's applied to the Aedes aegypti mosquito, you get this contest in the gut of the mosquito between this bacteria, Wolbachia, and the viruses that we know as dengue and Zika and yellow fever and chikungunya. And the bacteria wins. It actually prevents the onward transmission of this disease. So over the last 15 years, we've seen this go from an experiment to a deeply documented success story in places like Yogyakarta, Indonesia. They did a randomized control trial that showed 77% declines in dengue rates, 86% declines in hospitalizations due to dengue when you were able to establish Wolbachia in the wild mosquito population. And as best we can tell, this is a one-time intervention, one and done. So 15 years ago, when they did it in Australia, they saw huge declines. It has not come back. So really elegant, really exciting solution. The challenge we face now is how do we take this planetary health solution and scale it? How do we do that with financing? How do we do it with product innovation, et cetera? The WHO's target product profile for Wolbachia says that this should reach at least 1 billion people globally. The challenge, one of the challenges, is it's cost between $20 and $50 per person protected to date. That's a lot of money, particularly in this climate, this financing environment that we're in. So we've been working with the suppliers, we've been working with countries, we've been working with the WHO and other partners. We think we can get this down to about $3 per person protected. So we're turning a $50 billion problem around a really elegant climate and health solution into a $3 billion problem. And the first place we're looking to do that is in Indonesia. As I mentioned, Indonesia did the randomized control trial. I'm just back from Jakarta 3 weeks ago, where the Minister of Health signed off on a plan that we call the 100-100 plan. The goal is to scale Wolbachia to 100 cities, 110 million people protected in the next 6 years. The total cost of the plan, just to get nerdy and capital stack for a minute, is about $390 million, so call it $400 million, against immediate benefits within that 6-7 year period of $3.9 billion in direct health savings and preventing missed work. So 10x ROI on this intervention. And what we've been able to do is work with the Asian Development Bank to position some highly concessional loans for the country, to work with municipal governments and the government of Indonesia to get about 10-12% of the costs covered in the annual municipal budgets, to mobilize private investment to build the world's largest factory for creating Wolbachia-infected mosquito eggs. It's about a $25 million cost and will be, drive revenue and jobs and so forth in Indonesia. But the key to all of this, and Karlee alluded to this, is that catalytic grant capital, that de-risking capital. And we're in a moment when we're seeing real declines in donor aid. I do a lot of work with U.S. government, and everyone's aware of the pressures there President Trump's budget would have caused about a 65% decline in foreign assistance for health from the U.S. government being the biggest grant financer of health interventions around the world. So we're in a moment where we can't stretch aid dollars any further. We need to multiply them. And the way you multiply them is by bringing them into conversation and coordination with the other kinds of capital that we talked about. So we think we need about $40 million in grant capital to unlock $400 million in concessional debt investment and on-budget government spending for this project. And the good news is we think we can get half of that concessional capital in Indonesia. So we met with and we're developing a partnership with the Indonesia Business Council, the 35 biggest companies and philanthropies in Indonesia, and they want to step up and cover about half of that need locally. So what this creates is, we really need about 5% of the budget in global grant capital to make this happen. That's a pretty compelling leverage story.
It's a great example, Martin, and I'm going to start asking for what you want from these people as we go along, and then I'll backtrack. What's your one single ask to these folks when we go to them in a second?
Come back to me.
Okay, Robin, go ahead. Robin Speedie is the senior consultant. Thank you, Martin. Let's give it up for Martin. Great example. Very great, very detailed. Robin Speedie is a senior consultant in sustainability and preparedness at Fraser Health. So going from an Indonesian example to an example right here in BC. And Robin, you're going to give us a couple of very concrete examples of climate and health and how a regional health authority pursues those examples. So please go ahead.
For sure. Thank you, Peter. Hi, everyone. So maybe you're wondering, kind of to start off, why do health systems need leads on sustainability and preparedness or planetary health? And the reason is that we are actually big contributors to the problem. So globally, we produce about 5% of total emissions. And if you were to add up all of the health systems as a country, we would be the world's 5th largest emitter. So there's actually a huge imperative for us to be reducing our negative impact on the environment and taking those actions. And there's immediate implications as well for us in terms of health system demand and operations, because as my fellow panelists have shared, climate change and environmental degradation are making us sick. And so one of the best things that we can do actually for sustainable healthcare is keep people healthy in the first place. That helps us to manage our own carbon footprint, and it also helps to manage stress on the system. Things like wait times, right, which we hear about all the time in the news. So we have a strategy at Fraser Health that I'll share a couple examples from, but I just want to recognize that we are not the only ones doing this. All of the health authorities in the province are similarly working in this same direction. We have learned so much from Courtney and leadership in the Northwest Territories and with the Power Initiative. So there is a national, global, provincial, hyper-local movement around this, and we are all rowing in that same direction. So a couple of examples of specific projects to make this concrete. So one of them is around anesthetic gases, so commonly used in surgical procedures, and some have large environmental footprints. And we know that safe alternatives do exist, and some of them are actually a lot less expensive as well. So as a publicly funded system in healthcare, we have a responsibility to be making good decisions around this, not just from an environmental perspective, but also from a financial one. So desflurane is the first one I'll talk about, and I think Courtney's going to elaborate on that one too, but 2,500 times more potent than carbon dioxide in terms of its global warming potential. So this is something that there's a national movement around, a global movement around eliminating it, because we have clinically appropriate alternatives that we can use. So some medical schools are actually not teaching about it anymore. And this is a chance for us to make better decisions and really not have a negative impact on patients. So we're very proud at Fraser Health to have completely phased out desflurane in the spring of this year, and we're joining 100+ other hospitals in the country that are moving in that direction. Another one, nitrous oxide, commonly known as laughing gas. We use it mostly in maternity. It's about 260 times more potent than carbon dioxide. It's a significant ozone depleting substance. It stays in the atmosphere for more than 100 years. And what's interesting about nitrous is that a lot of our infrastructure in Canada, our hospitals, have piped-in systems of nitrous oxide. And those systems have been shown to have a lot of leakage, up to 97% in some cases. So that's obviously a problem from an environmental standpoint in terms of the release of that gas into the atmosphere, but also thinking about, again, the cost implications of that and the implications for our staff, because they shouldn't be inhaling that. So what we're doing is we're switching from those piped-in systems to deactivate them and have a portable supply of nitrous oxide, and that keeps the gas much more contained. So it allows us to have that protection for our staff and reduce that waste. These are examples of where I like to see a lot of overlap in that Venn diagram in terms of the win-win-win benefits for a health system, for patients, for staff, and for the environment. And we're focusing on initiatives with as many of those co-benefits as we can.
That's amazing. Thank you so much, Robin. And if there's one thing you could ask these folks for, what's your ask? I'm going to try and do them together and then backtrack.
Yeah, I mean, I think I would really just encourage you to use your influence. I think there's so much expertise and skills, a diversity of knowledge in this room. You know, where do you have those leverage points that you can tap into within your own spheres? And really just remembering and grounding yourself in the understanding that we are not separate from nature. We are nature. And so if you care about human health, we need to be caring about climate, and we need to be investing in these kinds of solutions.
Great. Thank you. And those were great examples. And if I might add, maybe even ask your local hospital whether they're using desflurane or nitrous. So Courtney Howard, I mean, she's got so many titles, they spilled over. The chair of the Global Climate and Health Alliance, founder of Power. You're doing a parallel session later, so you want to set that up. You have this national initiative, Power, and what I love about it is it's got a specific example, which is the desflurane, and I could say a few things about that, and then a broader mobilizing thing. So just tell us a little bit about that. Tell us a little bit about your session and give the one ask you want for the audience, and then we want to go to the questions when we pick up 3 more asks.
Sure. So I'm so excited to be here in the plenary. What wonderful presentations. It's really interesting to learn what's happening in different parts of the space. So I'm an emergency physician. I live in Yellowknives Dene territory on permafrost. I serve an area that is about 20% of the Canadian landmass, larger than France and Spain combined. So we have one CT scanner in the middle of the north of Canada, and that's it. In 2023, as many people know, our entire 100-bed subarctic hospital needed to get evacuated due to wildfires. And so it was generous health professionals in BC and Alberta and people also in Manitoba that helped us do that. So my patients ended up largely at St. Paul's Hospital, and actually I think some people from Fraser Health also received them. So you can see that we are already having massive health and health systems impacts from climate change. I'm now the president, it's not up there, of the Medical Association in the North, and I can tell you that 2 years out, it is not easier to keep an emergency department open when you are working with a population and physicians who had to evacuate an entire territory with no plan on about 3 days' notice. So we know from the Auditor General's report that came out in June that that's actually just what we should expect based on what we've currently built. We were late to creating a national adaptation strategy. We have not invested adequately in it. I was actually part of the disaster and risk reduction table. I thought we did a pretty good job, but it was difficult to coordinate. And for instance, wildfire smoke isn't even taken into account in our national adaptation strategy. And so we're deeply, deeply unprepared, and the Earth system is changing faster than we thought it was going to. So I'm lucky to work at local, national, and international levels. So with my international hat on, I'm the chair of the Global Climate and Health Alliance. We're the world's biggest convener of the health sector in this space. We have 215 member organizations. We've done things like help to organize the COP26 health program, in collegiality with the WHO and Healthcare Without Harm. So we basically showed up for COP26 thinking we were going to get maybe 9 countries to sign on to have climate resilient, sustainable, low carbon health systems. And I'm going to mention this because I think the tactics are important. We had early movers, the UK, we had a deadline, the US signed up halfway through, and essentially we had healthy competition create a race to the top where we popped out of COP26 with 52 countries having signed on. And so yeah. So when you think about the potential for that, we're responsible for 5% of emissions. We have 40 million healthcare professionals who each of them are a trusted professional in their community. And we allocate together 10% of global world product. So I'm now working with the International Tipping Points group, Tim Lenton and his group out of Exeter. They're very interested because we're amongst the most powerful and well-organized centers in the world. They think that there's probably no one who has a better chance of creating a new narrative and actual socio-political economic tipping points in service of a healthy planet. And so having done that internationally, that has made it way easier to get things done in Canada. So we, in fact, ran a very similar program to get all of the medical schools signed on to mainstream planetary health. It was a declaration on planetary health, same set of tactics. Yes or no question, deadline, had to announce it at an international conference. Once the dean started seeing that other deans were signing up, they all signed up. Popped out the end of that with basically national consensus amongst medical schools and now a roadmap for implementation. And so, thank you. Yes, we tried a lot of other things first that didn't work. Like this is 15 years into this effort. And so what that's really taught me is we're all very much part of a complex adaptive system, from the local to the national to the international, and what happens at each level really matters. And so what Power is now doing is we are working to accelerate the ground game. I led the roadmap, and so I interviewed all sorts of people for the implementation, and people said, look, I really care, but as the frontline health professional, I don't really know what I'm doing, and the curriculum surveys would support that. We've established that. And I need supportive structures to help me in the 5 minutes I have available at the bedside or the hour I have on a Sunday to do the work. And so what we're now doing is tomorrow's session is about helping them to do what what Fraser Health has already done, which is create a community-facing strategic plan, because the opportunity here is if the health system becomes an anchor institution of sustainability, that allows the trusted voices of healthcare professionals as they start to understand this in a learning by doing frame to lend voice to decarbonizing our electricity supply, to local sustainable food, to the local transport. And so my ask for you tomorrow is to come to our session at 3:15, because what we're hoping from this audience is for you to tell us how you want us to do that well. Sometimes doctors, we can be a little egotistical, we can be a bit uppity, we could do this wrong. And so we're gonna have questions for you like, who should be in the room? How long is this gonna take? What are the best ways for us to do this? What do you think the major opportunities are? Where could you see this going off the rails? We're gonna film the whole thing with a GoPro because I think this stuff's exciting. And we're gonna make a video that we'll then use to help train other people. So please, I know there's so much wisdom in this audience, please come to our presentation tomorrow.
Great. So far we've got come to a presentation, be a natural leader, and ask about desflurane and nitrous while you're at it in your local hospital. Martin, what's your one sentence ask for the audience?
I feel like I've spent a lot of time drawing a capital stack in the air, and so I don't want to have a technical ask, though there is a big leverage opportunity for the Government of Canada and partners here. I guess what I would ask is, I think we're in a moment where we need a mindset shift. I was on a hike last week, and I was thinking about, there's a quote by Arthur C. Clarke, the sci-fi writer. Any sci-fi fans out there? He says, sufficiently advanced technology is indistinguishable from magic. And I was playing with the inverse of that. A sufficiently advanced magic is indistinguishable from technology. And the solution I just described is nature magic, right? It is a naturally occurring bacteria defeating the virus in a mosquito so humans don't get disease. So building on Robin's comment that we are all nature, I would encourage us to think more about nature magic as a source of solutions.
Okay, good. Karlee, what's your ask?
Help us create some partnerships for action that bridge the local and global. I think this is part of the complexity in this space. as I told you, we've got a global partnership going, and I've got a few other things I'm even learning from this panel that I'm going to go follow up to amplify that as well. We've got a big opportunity to also do similar things in Canada and link that into what we're learning globally. So looking for some anchor investors that are interested in leveraging that Canadian talent. I also think we have a very big value add in Canada, thanks to the fact that we have Indigenous elders and knowledges that this is where they emerge from and have a way to show us the path forward and how we can leverage that, and can we actually be smart and put Indigenous innovators and their knowledges ahead of the solutions here, I think is a big one that I'd love to talk more about.
Great.
I'm an optimistic person, but I'll admit I don't think global emissions are going to be reduced anytime soon. And so we need to adapt. And if we're not adapting for health, then I don't know what we're adapting for. I think this is a diverse audience, and these are diverse asks. And I think we need a more robust response to the impact of climate change on health, and be able to enable a whole of society response more so than what we're doing now, including recognizing that climate change here in Canada is a global health security threat. And it's not just what we do inside of our borders, but largely what's happening outside of our borders is going to impact our health outcomes.
Great, thanks. So now over to you. Raise your hand if you've got a commitment, an offer, or a question that you want to ask. I just want to see how many there are, so we allocate the time. 1, 2, 3, 4, 5, 6. Okay, so come to the microphones. We've got about 12 minutes, about 6 people. That means about 2 minutes each, just to give you a sense of the timing. And we'll start over here, and please go ahead. And I think I'm going to take them all, if that's okay with you, because we want to hear from as many people as possible. And I'll come back to the panel for any kind of acceptance of offers or commitments or reactions. Please go ahead.
Yeah, so thank you very much for that. My name is Marie Chantal Ross. I work for the National Research Council. This is a little bit orthogonal to what you're used to talking about, so perhaps this will be a very quick question. Everything you're doing is really good. We've heard about smoke, we've heard about heat waves, and we've heard about flooding, all of which are caused by an unhealthy ocean. And so, the ocean being pretty much the climate regulator. Is there any work that you're doing, particularly Kevin and Karlee, but also Robin, is there work that you're doing that looks at pathways that lead from health to the ocean or ocean to health? For example, we know that microplastics might be vectors for disease. We know that droughts are what causes forest fires, et cetera. And the heat dome, that killed billions of ocean species, and we need to have healthy biodiversity for a healthy planet. So if you could provide a little bit of context and if you're doing anything and how.
Great, thank you for that. So question, comment 1 is around oceans. We got about 8 people now, so 1 minute and 30 each. Go ahead, please.
Hi, and I'm Tasha Nathanson with 7 Leagues Leather, and Marie Chantal stole a little bit of my thunder by mentioning microplastics. But what I noticed that was missing in some of your interaction of health and climate change are plastics, which the speaker from HP mentioned a lot of people don't understand are made from fossil fuels. I'll say that textiles, people really don't understand often that all that polyester, nylon, all those synthetic textiles are also made of fossil fuels. Those are plastics. They shed microplastics. And to personalize it, I have a family member with an incurable autoimmune disease, microplastics potentially implicated. Another who has terminal colon cancer, potentially, these are serious health impacts that are tied in with fossil fuels. And most of the energy is going into recycling synthetic textiles, which continue to shed microplastics. So just to put plastics on the table and also the connection to textiles, these are such interconnected systems that even something like fashion is connected to your issue, and to encourage that cross-boundary thinking.
That's great. Thank you. Oceans, plastics, over to you.
Yeah, thank you very much. I think what I'm really interested in is looking at what creates systemic health in communities and our connection even to the land. And I think that there is this, I've worked in this at the grassroots for more than 30 years and seen an absolute decline in the engagement of people, ordinary people at the grassroots, and that systemic, like the conditions that allow people to come together for, there is incredible potential when people can work collaboratively. Those conditions have declined dramatically. And I'm wondering if some of you could speak to how that's being addressed, because otherwise it's just siloed solution. Great, but honestly, the massive shift will happen where we're engaging with with communities that are connected to the land and to the place.
Great. Thank you. Oceans, plastics, communities, and
Hi there. Thanks to the panel. My name is George Benson. I work for an organization called the Zero Emissions Innovation Center. I think my question is mostly for Dr. Howard, but maybe Robin as well. I'm really interested in these action plans and roadmaps, how things get down to the ground, specifically in terms of professional governance. So we have colleges of physicians, of nurses, of many other healthcare practitioners. I'm an urban planner. I've been very involved in that aspect of professional governance. I'm really curious, how do you think these principles and values and some of these actions land into the rules that govern our professions? And if you have any thoughts on how do we learn from what the healthcare profession is doing and bring that into other sectors and other professions, I'd really love your thoughts on that. Thank you so much.
great, thanks. Oceans, plastics, communities, professions, and
My name is Justin LaRock. I've been a frontline mental health worker for a number of years. My question is primarily for Dr. Linn. I've seen that the vulnerability to climate disease caused by mental illness, such as, like you were saying, displacement, as you have people who are being moved on a regular basis, that they're homeless every single morning, being moved, pushed off wherever they have their tent set up. We also see that as emergency weather shelters. The only emergency weather shelter on this South Island is in Victoria, and so the entire homeless population from, frankly, almost all the way up to Sydney and out to Souk is coming down to Victoria when there's an emergency weather event, such as cold weather or hot weather, both sides of it. And this is removing everyone from the communities and their supports as well. So how can we begin the conversations of mental illness creating a significant vulnerability both to climate-caused disease as well as the climate impacts of mental illness, the single-use plastics in harm reduction, as well as the reliance on takeout and your immediate needs rather than taking more climate-conscious choices.
great, thank you. Oceans, plastics, communities, professions, mental health. This is going to get harder as we go. Please, go ahead.
Hi there, my name is Bella Claire Mackenzie, and I'm a North Island College, well, I'm on the student union there, and I do accessibility, and I'm also a in-person student at Douglas College on the mainland. And so I just completed, straight A's, a class in philosophy. Also, I started in environmental ethics because in a little lending library, I saw your, Peter Singer, I saw a book and it had an example in there in environmental ethics by you. So I would like to say that you're why I'm in this minor in my studies. And so my professor, he really went over these things called dialectics of process-oriented thinking. And so I just wanted to say, how can process-oriented community-based solutions, integrating maybe nature-based solutions and just bringing people together, how can process-oriented dialectics bring us towards a more utopian vision, and how can maybe imagery or bringing together bigger groups help with this? And I also want to shout out my professors, Dr. Richard Sandlin and Dr. Elliot Roster, who also does housing justice.
Great, thank you. So we've got 4 people. No, are you going to say something too? No. Oh, five. Okay, so we got four or five people. We got to do really quick because we want to have a quick reaction. So please go ahead.
Okay, I'm Mark Brown from the UN Food and Agriculture Organization, Near East North Africa Policy Team. My question was for Martin Edlund. First of all, congratulations on the Wellbeing progress, both the innovation and the creative capital stack. The question that I'm interested in, and I think maybe could be beneficial for a bunch of the innovators in the room, is what challenges with adoption at getting people to either opt into taking this human level treatment or not opting out, which, you know, some of the maybe vaccine promoting colleagues in the room have struggled with, and we know in international development, adoption at the ground level can be one of the biggest challenges. So I'd love to hear if you've had any challenges, or if not, maybe what you might attribute that to.
Great,
Thanks so much.
thank you. Three more?
Hi,
Please, go ahead.
My name's Scott Baker. I work with Supermajority. I spend my time thinking about the political capital and political will associated with climate. Hi, Robin. I've got a high-level question, kind of a simple one. The story I've told myself about COVID retrospectively was that we basically failed it as a social and political process, but due to like amazing advancements in science, we were able to get through. On climate mitigation, it's kind of a similar story that I tell myself about it, that we're not doing what we need to do socially and politically, but with this breakthrough in solar energy and other technologies, we have kind of a shot at it. And so my high-level question for you is on the health side of things and in adaptation, is it kind of the same story where technology is the thing and we're not on the social political side, it's not looking so good, or is it more nuanced? Thanks.
Thank you.
Hi, Alan Levine with the Canadian Centre for Food and Ecology. We're dedicated to inspiring Canadians to make food choices that are good for them and good for the planet. So given that our food system is both a leading cause of illness and poor health and the #1 cause of environmental degradation, what do you guys see as the role of food in changing things?
Great, thank you. And last question to you.
Hi, I'm Aaliyah Berry. I'm with the Canadian Medical Association, and I'm just hoping to get your thoughts on artificial intelligence. I know that we've spoken about innovation, and we're at a point in time where AI is not going anywhere. It is going to be implemented in healthcare, but there is this balance that needs to be had in terms of the environmental impact that AI has on like the double-edged sword. So I'm wondering to get your thoughts. Yeah, thank you so much for an amazing panel.
Great, thank you. So let's give it up for all those excellent questions and comments. We probably have about 1 minute each for people to just pick up one or two things that you found really cogent that you'd like to respond to, action-oriented if you can, and then obviously we'll follow up after this during the break and stuff. So Kevin, why don't you go ahead?
Yeah, so the question on oceans, I just finished interviewing women in Senegal who were facing displacement from oceans and erosion happening along coastlines. And as men have left villages to seek livelihoods elsewhere, this has provided opportunity for leadership for women. And the way women are stepping up in using palm fronds to create barriers and fencing along the coast in the sand to prevent more extreme weather from washing away villages has been very successful. They've also been planting mangroves to also further prevent erosion, which is also then providing habitat for oyster growth, you know, impacting that food security pathway. So there is some interesting work happening on oceans, and I don't think we can or should be forgetting it. But to the comment, you know, are we failing? In a way, I think we are, but in certain contexts. You know, when I think of the women in Senegal, that is community coming together, that socioeconomic perspectives are advancing and working well to protect those communities.
Great, thank you. Any action you want to take from the things you heard?
Not off the top of my head.
Karlee?
Great set of comments. I was going to pick up on the ocean thing. We do have a few solutions we've already supported that are underway. Happy to talk through those that relate to ocean health and how that's a route to health as well, similar to what Kevin just said. And then I'd also love to pick up, my way of saying it was around the kind of community dialogue really needing to be unlocked for a lot of these solutions to come to bear. Just a big yes. And I think this is where rethinking of like, who is an innovator, who is a solver, how do we get to them is really important. And that's part of what we do is make sure that we get uncommon people to the table and part of that solution making.
Great. Any action you want to take or anyone you want to hear from and connect with afterwards? I guess you just kind of mentioned it. Okay, Martin?
Two of the comments to pick up on quickly. One, I was intrigued by that question around, are we relying on techno fixes or are we relying on people and social change? And I think it has to be both, but I think the people piece is without which nothing is possible. And, you know, if we have a chance of changing mindsets about the climate problem writ large, I think it's through the lens of human health. I think health as the human face of climate change is our best, most tractable opportunity for how to inspire and change minds around this. And that brings me to the other comment from the colleague from the UN about adoption and kind of local engagement. Any conversation about innovative solutions for these problems has to start with trust. And there's so much misinformation. You know, COVID really brought that to new heights, and particularly around counterintuitive solutions like turning the mosquito into the solution for the problem. It has to be all about working with and through community networks, making them not just aware of the solution, but part of the rollout of the solutions if this is going to work. Because we've seen, and Burkina Faso halted activities around a different GM technology for mosquitoes, but you know, the example holds. It doesn't take much misinformation to stop these transformative life-saving solutions in their tracks, and trust is the difference.
Great, thank you, Martin. Robin's mad at me because she said, well, just take like 3 questions and then didn't quite do that. But anyway, Robin, please go ahead.
So I'm just going to touch on this notion that's come up a couple of times about being an anchor institution, and that's really what we're trying to be at Fraser Health. I think it hits on a number of the questions, though: plastics, textiles, systemic solutions, process-oriented thinking, social benefits, the role of food. Check out some later sessions. There's a wonderful one being led by Nourish this afternoon. It's a 2-part workshop all about food and anchor leadership. But the thing that I want to say about it is that we can have these solutions that really do it all. And when it comes to something like being an anchor leader, we can have environmental benefit, we can have social benefit. So single-use plastics is one example where the more we can convert to reusable options for things like surgical gowns, any sort of equipment and supplies where it's appropriate not to use that single-use option, we obviously save on the carbon footprint from being produced and shipped from overseas, individually packaged, used once, then thrown out. But we also have social benefits in terms of making our system more resilient to supply chain disruptions, to events like COVID-19. And it also helps our local vendors because we create these local circular economies where now those gowns get laundered right here in the Fraser Valley. And so we're creating jobs. We know that income, that leads to better health outcomes. So you see it comes full circle here in terms of social determinants of health, investing in our communities, investing in people, and also just doing the right thing as a health system. So that's where we're at. We're doing our best to bring all of that forward every day, and join us.
Thank you. Thank you, Robin. Oh, there you go. And Courtney, last word to you.
So for me, the opportunity in this, as all of the communication studies show, is that people work for the well-being of themselves and their families out of love. That is what motivates humans. Every patient I see at the bedside, they want to be well, they want their kids to be well into the future. We know that on a macro level, that's what the communication studies show as well. We know that health is one of the most motivating things, and health practitioners are motivating. So the more we can mainstream planetary health, I think within health institutions, and have that spread out into the community via anchor institutions, the more we can start to seed that from the ground up and work towards what I think is needs to be our new goal societally, which is long-term well-being for all, using metrics that are based on the SDGs and a planetary health lens. And so in response to some of the questions, when you think of that as your goal, what are the barriers? Well, within medicine, having done a lot of interviews, the senior leaders didn't know what they didn't know. So it's not like people are bad people. They have competing priorities and they're busy and it's not on the agenda. So the transformative change we have seen is when senior leaders have been briefed. People aren't dumb. Like you put a graph in front of someone who's well-trained, they're like, oh. And so the key is to change the view from environmentalism as being something that's lateral to an understanding that we all live. The model I use is a planetary health nest. So I will get I see the Canadian Medical Association president here in the audience. And so that's a huge win, really, from the perspective of influencing medical associations. That took 13 years of concerted effort to get our medical institutions, the colleges on board. And the way that I presented a lot of data at first, so many Lancet studies. And what I finally realized maybe 5 years in is that it wasn't a head problem at all. It was a heart problem. What I was saying was making people sad, and it was making them guilty, and it was making them angry, and it was making them feel scared. And because they didn't know what the action item was, and they were busy, they couldn't grapple with it for long enough to figure out what to do. So what I would really invite you to do is to, in all of your presentations, look for 3 different parts to be a component. So the head part, the heart part, surface those feelings about 30% of the way in, and then the hands part. What do you want them to do next? And that means you have to do a lot of the legwork. The homework is on the back end. You need to show up ready to give people that first step. And so I think that with everything we've heard, we're making a ton of progress. As someone who lives in a place that's warming at triple the global rate and is deeply embedded at this moment in trying to keep that health system running, we will not be able to adapt our way out of this. And I was actually part of a Chatham House rules discussion at the last climate change negotiation where The Economist convened health systems adaptation experts from around the world and said, can we adapt out of this? And they said no, consensus. So we are right now in the last part of our mitigation window where we can essentially stabilize this complex adaptive system that we're all totally dependent on for our health and well-being. And so for me, what I'm working so hard to do right now with all of the different elements and networks associated is use the power of the health and health systems voice, including concrete change, because visual change motivates people more than anything else, to say, hey, climate change is the biggest health threat of the 21st century, and safety lies in a planetary health approach and adopting new metrics and a new goal. And so I think that really at this moment, AI, what we're using it for, is we're looking to use it to do a better job of mapping our network and matching what people need to demand so we can, as quickly as possible, tip those socioeconomic and narrative tipping points to give people the head, the heart, and the hands that they want. So thank you for everything that you've offered in terms of insight, and I look forward to talking to you for the rest of the conference.
Great. So just to wrap it up, because we're at time, my summary is go to Courtney's thing, a great Canadian initiative where you can actually do something. If you're in a regional health authority or a hospital or you're on a board, talk to Robin because she's got some very concrete ideas. If you're interested in the capital stack idea, you know, the future of international development is going to depend a lot on multilateral development banks. This is probably the best concrete example I know of specific about implicating, in this case, the Asian Development Bank into a capital stack and also local philanthropy. If you're a Canadian partner interested in climate and health, please join the Climate and Health Grand Challenge. And if you're struggling with what climate and...
Come find me and Keegan, my counterpart over there.
Come find Karlee and Keegan, her counterpart over there.
Yep.
And if you're interested in kind of pinning down in your organization, well, what does climate and health mean? Get Kevin to come and help you because he did his whole thesis on it. So thank you very much. Thank you to the audience for all those great questions and comments. Thank you to the panel. And we're done here.
Don't you feel better with a doctor in a room, right?